Clinical Conversations on today's Smart Chiropractor Show. Clinical Conversations is our segment each and every week where we highlight the clinical aspects of practice, and we have been showcasing many of the fantastic talks that we had during Axis 2021, which was our online clinical event. Axis 2022 is going to be coming your way later this year, so stay tuned for details. 2021, stacked lineup, awesome information. That's why we've continued to highlight the docs that took time out of their day to share their expertise. Nothing better, in my opinion. And today we're going to revisit Dr. Tera Giroux as she discusses Fight Week Rehab at the UFC Performance Institute. Dr. Tera is one of the top chiros within the UFC Performance Institute. We know a lot of docs out there, a lot of young chiropractors and experienced chiropractors love sports chiropractic, and there is no question that the UFC has grown by leaps and bounds. Multi-billion-dollar corporation, from illegal to multi-billion-dollar corporation over the course of 20 years. So the growth of that sport has been tremendous. Tera is, again, one of the fantastic chiros and one of the top chiros on the team over there at UFC. So if you've been interested in Fight Week Rehab, let's take a look. We're going to look at a clip from Tera Giroux breaking it all down during Axis 2021.
So what we want to do is to get her through this fight camp. Our interventions, we're going to really focus heavy on stabilization exercises, specifically through the shoulder, the scapula, on the cervical spine. Basically, we're at this point, we're managing her symptoms. We're noticing we're basically just maintaining, and that's about as good as we're going to get. The athlete's aware of this. We sit down and we kind of always, we check in with them every single day, every single week on the progressions, how they're feeling about it, how we're feeling about it. So again, relying on soft tissue techniques such as massage, ART, Graston, fascial manipulation, dry needling, cupping, using modalities like shockwave, lasers, things that we like that we have in the clinic. So again, just kind of her response to treatment would be ultimately she would feel better after treatment. It would reduce or kind of maintain her symptoms on a lower level, but would flare up again kind of during training when she would have hard trainings at the end of the day. Again, athlete understood this as her care, and she understood that she is going to need to seek surgical opinions after this fight. So Fight Camp Rehab, kind of in an interdisciplinary collaboration. So you guys kind of know obviously what we've been doing, but S&C wise, a lot of these athletes are doing 3 to 5 times a week with strength and conditioning. And depending on what their initial diagnostics or goals say, that's what their program is going to be kind of tailored around. So for her in specific, we want to improve cardiovascular function. We're working on kind of time and load management. We're focusing on, the right amount of reps and sets and having that come into play with her MMA training schedule and loads. So due to her diagnostic testing and what the S&C team decided after they analyzed the results is they designed a program to improve her maximum strength. So that was one of her weakness on kind of her test, is just to overall strength within the weight class. Something that I hadn't mentioned yet, but I want to, is that she's recently moved up a weight class. So she used to fight at 115. So she's now fighting at 125. So one of the goals is more of a hypertrophy program for her to improve her strength, to help to kind of support herself in this new weight class with bigger girls. So sports science wise, we use a wearable device called the Oura Ring, which is really similar to like the Whoop Watch or the Omega Wave. So it's going to monitor her recovery. It's going to monitor her sleep. It's going to monitor her fitness, her training. It's going to give her good HRV reads and really just tell us what her readiness for the day is. Nutrition-wise, we had a consult with her in order to support her needs through the fight camp, but also recovering through this injury. So she's taking her normal daily supplements. Her diagnostics, she has a history of anemia, so she's on iron. Her hypertrophy wise, since we're kind of trying to bulk up to recently move up to this new weight class, we're going to put her on a caloric surplus as well as add in creatine. And then a little bit more for the soft tissue repair and injury that we're dealing with. We put her on collagen as well as some inflammation control, such as turmeric, omegas, and magnesium. Now, we also pulled in sports psychology for this because it's really important when you have an athlete that has to modify their activity so much, or they're dealing with pain and they can't train like how they want to. That's going to increase anxiety throughout that fight camp, especially when you're not sleeping and recovering well either. That just tends to kind of increase anxiety around everything, that you really can't feel rested and recovered. Now, the fight week, her original fight date was supposed to be in October of 2020. However, a week and a half before her fight, she tested positive for COVID-19. So unfortunately, we had to push the fight back. We rescheduled the fight for the end of November of 2020. So we pushed it back about a month. The result was that she did lose by decision. And so what I want to talk about kind of next is our transition into what our COVID return to play protocol actually looks like. I think it was a cool thing to be able to add into this so you guys can kind of see how we handled the situation of her testing positive for COVID in the middle of this fight camp and fight week. So here are some implications. So this is from the British Journal of Sports Medicine. As you can see, there's different stages of return to sport, and we're monitoring a bunch of different things, right? We're monitoring subjective symptoms, we're monitoring resting heart rate, SpO2, RPE. We're looking at objective measurements. So, are they recovering? What's their cardiorespiratory system like? What's their heart rate like? What's their increasing their load look like? And we have to also go by stages of duration. So the first stage is going to be that 10-day kind of minimum quarantine for these guys, right? So they're resting, maybe they're walking if they feel good enough, they're just doing their normal ADLs, and they're just allowing their body to recover. As we advance into kind of stage 2, they're allowed to do some lighter activity. So maybe walking, some light jogging, some stationary bike, but no resistance training. And we really want to keep their heart rate to under 70% at this time for no longer than 15 minutes. So we're just looking at, are their symptoms increasing? That's just basically the overall goal, or the overall idea of when we should advance them to the next stage. So do their symptoms, are they good? Do they not increase, either at the point of that exercise or within the 24 hours after that? If the symptoms don't exacerbate, we can move on to stage 3 and so on. So here's the American College of Cardiology's return to play protocol. As you can see, they kind of got this like nice little flow chart. It's pretty similar. So again, if they're COVID positive, depending on if they're asymptomatic, they have mild symptoms and they're not hospitalized, or they have significant symptoms and they're hospitalized. Again, if you're symptomatic, you're resting until then, and then after 2 weeks without symptoms, you can slowly start to resume activity. Again, you're just monitoring for any type of deterioration or exacerbation of symptoms. Now, some other professional sports that we had found kind of on their return to play, we've again been able to pull a few things, which is awesome. So again, just basic COVID positive athlete, 10 days rest from positive result. If they're asymptomatic, on day 11, they do a full cardiac exam, full labs, focusing on troponin levels. And if those levels are normal, they can kind of return to the team and work up to their capacity. If they're symptomatic, you're going to have your rest and isolation for 10 days after that positive test, and then another 2 days post-symptom resolution. So kind of general consensus on these were that they were kind of just doing this kind of 4-day return to play protocol. It's going to be longer, obviously. You're going to stay in that phase if you do have symptoms until they're better and they don't exacerbate. So due to that, I'm going to go on to what we've decided that our return to play will look like. So day 1 is we're going to keep the heart rate under 70%. And no more than 15 minutes, we're going to do a steady state aerobic activity. So it could be light walking on the treadmill. Normally, it's just a watt bike, just something that they can kind of sit. We're going to have a heart rate monitor on them to make sure that they're not going above that 70%, and it's going to be completely monitored. They do good with that. They have no exacerbations during or after, and they come in day 2. They're like, yep, I felt good, no issues. We can bump them up to 80% of the heart rate. And we can also go up to about 30 minutes at this time. So we're seeing kind of that low to medium level aerobic intensity at that time. If they feel like they can good enough, we might be able to get them on the treadmill to do a 30-minute jog. If they can tolerate it, again, we can do some static technical training. So maybe just going and just hitting some bads for 15 minutes. Day 3, we're going to up it a little bit more. So they did good with kind of their cardio so far. We're good with allowing them to have no cardio limitations. So we're going to be able to bump that up to kind of a moderate activity output level, about 45 to 60 minutes of training. We can reintroduce at this time some more tactical training. Want to keep it still to about 30 minutes at about 70% level. And as long as they do good with that, no exacerbations, day 4, they can have a full return to activity and resume normal training. So back on our kind of post-fight now. So she fought, she lost. It's now coming into end of November, December. She had a medical follow-up for her post-fight exam with our medical staff. They re-MRI'd the right shoulder and kind of still the same findings, a bunch of labral findings, mild tear and infraspinatus, lots of tendonitis and supraspinatus, teres minor, subscap, biceps tendon. So we decided to go ahead and go on with a consult of an orthopedic surgeon. They obviously recommended that she go ahead and get surgery, but we wanted to discuss all of the options first with not only us, the athlete, her manager, her team and training partners, and the medical staff of the UFC. After we kind of all met, we decided that we would go ahead and the next step will be a surgical intervention.
All right. Great information from Dr. Tera Giroux over at UFC. You want to talk about taking care of some banged up people? She sees them each and every week. And depending upon when you're watching this episode of the Smart Chiropractor Show, I believe she's in Singapore right now, taking care of some athletes before their event this coming weekend. Jason, what are your thoughts?
I mean, what a job to take on. I mean, you're dealing with people that are just getting busted up week after week after week after week, and their lives and livelihood depend on their ability to count on their team to keep them tuned up and tuned in. So good for her. I appreciate the ability to go from most of us as chiropractors think very independently. I'm the chiropractor. You come to my office. I think differently than everybody else. I'm going to provide the service that I think is best for you. And more often than not, it's different advice, different care than they would get anywhere else. When it comes to working in these types of environments, you have to make that mental adjustment to really be part of a team. The ability to read MRIs, the ability to know when there is a need for medical care versus conservative care, et cetera. So good for her. She's passionate. She's knowledgeable. She's putting her skills to work in an area that, I love when chiropractors break out of our four walls in our own office and step into other environments, whether we talked with the chiropractors who are part of the NFL or many others, they're breaking out of their bubbles and working in the real world with other types of doctors, with other opinions, and really develop the ability to work as a team and not just go, well, if you're not going to do it my way, then I'm not going to participate. So there's a very special skill in all of that I deeply admire, and good for her. I just think it's awesome to both feel her passion, but also know that, a lot of these athletes can choose all kinds of doctors. To have a chiropractor on her team and specifically to have her there is just a tremendous testament to her skills, her talent, her persistence, and her ability to really connect with others and provide value. Bravo.
Well said. Yeah, a lot of those athletes, I did not know this, but it makes sense, are independent contractors within these organizations. So getting well and staying well, if you're not out there under the lights, you ain't getting paid. So it is a lot of pressure. Kudos. And thank you so much, Tera, for coming on and sharing during Axis 2021. Stay tuned for those details on Axis 2022 coming up soon. Thank you so much for watching this video on the Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.